Dental hygiene is important.
Freshens breath formulated for dogs. Can you move his tongue now? For brushing time. You listen to him before I Yeah. Cool.
And she's a little stoic, but not that. So if I don't push on the toes, she doesn't really care. But if I flex to about 90 and then do that, she's like, ow, please don't do that. So about 90, and then I try and grab, her toenails actually aren't that long to specifically target the deep, but either way, she's not a fan.
Okay.
But otherwise, her range of motion is pretty good. Olive is here today because she's had this on and off again hind limb lameness. Her owners mostly see it after she plays really hard with her housemate, or if she's like done a bunch of stairs going up and down, and she wouldn't hold the leg off the ground, but she'd just be kind of putting less weight on it. When they've restricted her activity, it would get a little bit better, but it always seems to come back. And giving her pain medicine didn't really seem to make a difference. So they went to a hospital in Connecticut where they did a CT scan of her rear limbs, and they found some new bone that was put down by the body sort of along her deep digital flexor tendon, which is one of the tendons that goes all the way down to the toes and allows them to flex. So they came here to talk about some options of how we can help her. So today we are going to use our ultrasound here to look at that tendon specifically and follow its course as it goes down the inside of the leg past her ankle. We won't probably go all the way down to her toes, but we'll look at sort of that middle section as it travels through the ankle, and we'll compare it to the normal side. I'm expecting that we'll see this tendon is a bit bigger in size, circumferential will be larger, and it'll just look a bit angry. And then, assuming we don't find anything else, we will inject steroids into her ankle joint, and the ankle joint communicates with the tendon sheath that surrounds that deep digital flexor tendon, and the steroids are going to help calm that inflammation down and should make her feel a lot better.
So Liam came to us because he had a lot of growths, over 20, 30 growths that were benign, but nevertheless opens up and bothers the dog. So the only way to treat these growths, which were hair follicle tumors, is to remove them. And because they ranged in size, the larger ones would need to be removed surgically with a relatively wide margin. So that is why Dr. Runge, the surgeon, removed those. And then I removed some of the smaller ones because they were easier to remove with the laser. So during the procedure, we removed about 20 to 30 growths together. We mainly wanted to get the larger ones that were draining fluid and material. All of them healed up well, and without any sort of complications. Even some of the larger ones that we had to leave open, and the dog has been doing well, although it does need to be managed for his allergies going forward as well.